Hi everyone. So we are on Module 10 now this week, and Module 10 has a couple of different sections to it. We're kind of fitting in a lot this week, and I'm hopefully not overwhelming you with resources and information to read over. But so this week we're focusing on assistive technology, research, and policy, public policy. So the presentation I'm going to give today, the little lecture, I'm just going to be talking about assistive technology. It's one of my little areas of interest, research interest. I've had a publication on assistive technology. I absolutely love assistive technology. I have an extra certification in it. I've taught classes in it. So I thought I would go ahead and talk about it a little bit today. But you'll find under the folders for research that there's a little video about the importance of research and counseling, why we do it, why we use evidence-based practices to conduct research in counseling, even though we're soft science. Or so-called soft science, I guess you would say. And then under public policy, I have a lot of different websites for you. So you'll see under the public policy folder that there are a lot of different counseling organizations that are really pushing toward advocacy for the profession and making sure that our clients are receiving what they need to be receiving in whatever realm that we're working. So you're going to see that I've got some links to just the ACA, their government page and what they're doing, the national NADC, the Organization for Addiction Specialists. I've got them on there as well. I'm not looking at it right now, obviously. And then NBCC, that's the counseling board and what they're doing in terms of public policy. So things are always changing. If you're interested in getting more involved from a professional advocacy standpoint, I mean, any of those organizations, they're happy to take additional members, and it's something that we're always needing, people that are willing to kind of do that extra work to ensure that the counseling profession is sustainable and that we have jobs down the road, and that the rest of the world and the rest of our country understands how important our job is and how important it is for our clients to receive the services that they receive. So a lot of legislative action takes place around all of that. So I encourage you to check out all the other links, and then the discussion post today or this week that for Module 10 is focused on assistive technology. So WVU does not have a rehab technology or assistive technology focused class. Some universities do. I've taught that before. It can be a bit overwhelming to think of focusing on assistive technology for a full 16-week period, but it's worthwhile, I think, because in our roles as counselors, either we are going to be having clients that are using some type of assistive technology, or we are potentially referring out for an assistive tech service, like an assessment, orientation, mobility training, driver rehabilitation, you name it. So it's important for us to be aware of not only what assistive technology is, what it means, but how we need to continue to keep up to date on the types of technology that are available for our clients, because especially now, in our technology-driven world, assistive tech changes all the time, like all the time. But it's really neat. I've always enjoyed just learning about the different changes in assistive technology. So let's get to the definition. So this will be important, of course. So if you're taking notes, I would say this first slide on what is assistive technology, or AT, is important. So AT is just any kind of device or service that is used as a tool by any person with a disability to achieve or maintain function. That's the actual definition of it. And all this information comes from the Assistive Technology Act of 1998, which was reauthorized in 2004. So there's a law out there that talks about assistive tech. And the AT Act actually provides us with the service of our state AT projects, which are very important for you to know about. And so that's another area not only where you could be working at some point in your life, but you could always refer clients to your state AT project as well. So when we're looking at the definition of AT, we're looking at either a device or a service, okay? So a lot of times when we're thinking about AT, we're thinking about the device, the piece of equipment, the product. And this can be something that is off the shelf or off the internet, something kind of like tactile. You can feel it, you can see it. And it can be acquired commercially, meaning that it's produced for the masses, but we're using it in a different way for somebody with a disability. Or a device could be something that's modified or customized even. It really doesn't matter how the device came to be, just as that it's a product that's helping somebody achieve or maintain function. And this could be things that are used on the job. It could be things that are used at home. It could be both. It just doesn't matter. So an AT device is that actual piece of equipment or product. An assistive technology service, an AT service, is any kind of service that assists an individual in the selection, acquisition, or use of an AT device. So this is kind of that extra stuff that comes along with just using the AT itself. When we're thinking about the Assistive Tech Act, the AT Act, it's considered to be the centerpiece of assistive tech legislation. And like I said, it gives us the AT projects that are funded both federally and on a state level. And within these AT projects, so for example, here at WVU in West Virginia, the AT project is relatively small, but an amazing service. And they have their offices located at the Center for Excellence in Disabilities, the CED, here in Morgantown. So if you're here on campus, you could go and visit them, actually. You could go and visit the AT Center. And you can go in, and they've got a couple rooms set up. They're also connected with Agribility, which is a different service. But they in the CED, they have like a room set up that's a mock kitchen that's accessible. They've got like a little living room area that where people can try out products like chairs that'll lift them up, different types of lamps. They've got like a gardening center, so you could go and see the adaptive tools for gardening. So, and then of course they have kind of the more tried and true AT products on display or available for loan. So that's like the alternative keyboards, alternative mice, switches, some products for children as well, different types of software for access to computers. So these AT projects, they all look a little bit different, but mainly they do device loan programs. So before somebody actually goes out and modifies their home in a huge way or purchases a product that costs like $2,000, they can go and try them out at the AT project. They loan them out for like a library does, like for a 30-day period or whatnot. And so somebody can try a product before they buy it. They offer demonstrations. So at Jan, I would always take new consultants over like every other year or so and have a demonstration by the AT project. And if we were all on campus, actually, maybe that would be something to do next year when everybody's on campus. So to organize a demonstration with them. They offer reutilization programs. So sometimes people age out of products. Sometimes they're just not needed anymore. And so rather than these devices just sitting in somebody's closet at home, they can put them back into the system so that somebody else can use it, use that device or purchase it at a discounted cost. They provide assistance with either kind of hooking people up to different ways to get the products financed. And then, of course, just as every organization, they're on the forefront of policy development and advocacy around the provision of AT for individuals with disabilities. So there's various categories of assistive tech of AT. You've got the aids for daily living, adapted tools to help people zip up zippers or put shoes and socks on or get out of bed independently, or different types of alarm clocks so that individuals who are deaf or hard of hearing can have their bed kind of shook underneath of them in order to wake up. There's augmentative communication, AAC devices for individuals that are nonverbal or have speech difficulties in general. Lots of different computer applications. There's a million and one different ways to access the computer. I've always said that if you can blink and or breathe, you can access a computer if you are able to find the right tools and able to get the financing for it. Environmental control systems, so those are turning on the house lights, locking the doors, turning on a television. All of those are the kind of looking at our environment, where the person lives and how they can control things independently, which kind of bleeds into home and worksite modifications. Prosthetics and orthodontics kind of fit into a category of assistive technology. Seating and positioning for individuals that use mobility aids. It's very important that a person that is using a wheelchair or a scooter is not sitting in the exact same spot every single day, all day, because they will develop sores, and sores can lead to infection, and all of that can lead to hospitalization. So seating and positioning is incredibly important, and there are people out there that specialize solely in seating and positioning. Actually, the University of Pittsburgh, so Pitt in downtown Pittsburgh, they actually have like a whole seating lab on their campus. Their master's program is focused on assistive technology largely, and they do trainings and really on the forefront in terms of research around assistive tech. So that's a little tidbit of information there about their master's rehab program. So there's lots of different aids for individuals that have vision impairments or who are hearing impaired or deaf. Wheelchairs and mobility aids certainly fall into a very large category of assistive technology, as they're all different kinds, types, sizes, and bells and whistles for wheelchairs anymore. There are wheelchairs that can be linked up to iPhones, and people can control their environment straight from their wheelchair and their iPhone. So there's lots of different products out there in terms of mobility aids. And vehicle modifications, because of course people want to be able to get around independently. I used to work with an individual that had no arms. He was born without arms, and so his vehicle was modified so that he could drive with his feet. I also worked with an individual who had a unique genetic disorder, and I can't remember exactly what it was, but she was a little person, and she had her vehicle modified as well so that the pedals were extended so she could reach them, and her seat was lifted up a little bit so she was able to see out the window. So there's all kinds of vehicle modifications that can be made, and oftentimes somebody needs to go to driver rehabilitation training so that they can safely learn how to drive their adaptive vehicle before we just put them out on the road. So I'm going to go through a couple of these categories, and I've got a lot of pictures on these slides. I hope you guys enjoy the pictures. I always like being able to visualize what some of these products are. And really, even though we don't have a class in assistive technology, it's something that you will probably continue to hear about in some of your classes, like the case management class, client services class, potentially. Start to become familiar about where you can find these products. And the Job Accommodation Network, I know I swing back to them all of the time, but they really truly are an incredible resource for finding products, like different types of assistive technology. And so they have like a vast database of vendors and products that are available, including all of the ones that I've found on here, because I developed this presentation initially at Jana. All these products are things you can find at their website. But when we're thinking about mobility and manipulation, these can be wheelchairs, those standard wheelchairs that we're thinking of, the ultralight ones. There's lightweight, high strength ones. There's the standard manual. There's powered wheelchairs. There's recreational wheelchairs. So if somebody likes to go and hunt in the woods, and they're using a wheelchair. There are specific wheelchairs that have like this incredible like tread. It looks like a triangle almost, and so people can get off-road essentially on their wheelchairs. Wheelchairs can be very expensive. There are wheelchairs that will allow somebody to go from sitting to standing so you can reposition themselves. All different types. I mean, there's wheelchairs for children, wheelchairs for individuals who are obese, and everything in between. And I have a picture of one such wheelchair here, but the price range can be anywhere from $500 for those, standard manual wheelchairs that we see, like, in a hospital setting or whatnot, like propped up against the wall in the entryway, all the way up to, over 20 grand. So they can be very pricey. And the thing with wheelchairs and any mobility aids, like the scooters, motorized carts, the picture that I have kind of on the top right-hand side of the slide is like a mail cart, essentially. So that's a nifty little product if somebody can't get around like a large campus, but they need to deliver mail or packages or whatnot. That can be a nice little mobility aid that can be an accommodation as well. So they need maintenance. That's my main point here. Mobility aids need maintenance. their tire tread may wear out, they may malfunction. Some of them that are battery powered need to be near a power source at some point if they're running throughout the day, or they need to have a backup battery. So these are things that are kind of the other things we would need to think about if somebody is entering into the workforce or looking for a job and is using a mobility device. Driving aids and vehicle modifications can be so incredibly expensive. I mean, the accessible vans and accessible vehicles in general, the baseline costs for those are crazy high. And then if you think about the specific adaptations that an individual might need, on top of what the vehicle comes with, then the cost continues to grow and grow and grow. So if a client needs a vehicle modification or needs an accessible vehicle, it's not typically a matter of, oh, you need this? Okay, well, let's just write this into your plan and we'll get you one next week. So it takes some planning to get those vehicles in general. And working with children, if you're working on a transition team, for example, if you're working with somebody that's using a mobility device, has a 504 plan in the schools, it may be that you're writing, a vehicle into your overall transition plan, with the expectation that, if you're looking at starting transition planning at age like 15, for example, or 14 when you're supposed to, then you're putting away the funds and saving up essentially so that when the student graduates high school, maybe at that point, they've got enough money in the bank to be able to go and purchase a vehicle that they can then use independently. So the other pictures that I have here are pedal extenders and then hand adaptation. So if somebody is needing somebody that doesn't have the functioning of their lower extremities is able to drive completely with their hands. Some really neat tools for mobility manipulation. 3D printing is really on the rise now. I mean, anybody can buy a 3D printer. My brother-in-law has a 3D printer and prints off little toys for my daughter all the time. It's crazy. But the neat thing about 3D printing, if you think about a child that maybe uses a prosthetic device, the child is growing. And those prostheses are so expensive. And I'm going to keep saying that over and over because AT can be very expensive. But what a 5-year-old needs in terms of a device is not what they're going to need 10 years later. As they grow, the products need to grow with them. And so 3D printing has kind of come about. I mean, there's a hand here essentially that's been created from a 3D printer. Robotics are also kind of on the rise too. The XAR is like this exoskeleton that can be worn, and Lowe's actually was trying a product like this out with their employees in general as a way to reduce injury and reduce workers' compensation costs. They did like a pilot study a couple years ago where they equipped a number of their laborers with these exoskeletons in order to help support them when they were lifting and moving items. So these products really truly are out there. They're out on the market. They're being used commercially, and I think they're really neat. And like this virtual presence, that's also something that can be, kind of robotics tool as well. But this is a nifty little device. The woman is looking at that little screen with another person on there, and that's a robot essentially. So the person that's working remotely is controlling it and is able to move it around an office setting. It's crazy what's out there. In terms of communication is something that we do every day, all day, typically, whether it's verbal or nonverbal communication. And I went ahead and listed some of the most common AT options that are out there for individuals with a wide variety of disabilities. So whether it's putting information in a computer in a different way, via voice like speech recognition, or smart technology, there's all different types of keyboards and mice. There's eye gaze technology, so you're controlling your computer with your eyes essentially. There are sip and puff systems as well, so that's where you breathe in and out, and that's controlling like a mouse function or your computer function. I've used some eye gaze technology before, and it's really interesting. And it doesn't, it tracks your eyes essentially, and then when you dwell on one little area for long enough, it'll engage that. So pretty interesting tools, and you can find YouTube videos on all this stuff too. And if you want to see videos, so there's the CAP program, CAP, cap.mil. the Computer and Electronic Assistance Program, which is through the federal government. They have a nice series on YouTube. They have a YouTube channel that maybe I'll try to link at some point, where they show how to use alternative keyboards and what they look like, or eye gaze technology, or different types of communication aids like assistive listening devices. And so I would say if you're interested in learning a little bit more about that, that would be a good point of reference for you too. So on the right side of this communication slide, we've got the products that are available for individuals who are deaf or hard of hearing, like cochlear implants, CCTVs, for individuals that are blind, Braille embossers, Braille keyboards. There's alternative phones like the TTY, which is pretty standard, but a lot of times people are using video relay now, so they're kind of communicating via sign language over the phone, but that's all on video. Assistive listening devices basically take sound and amplify it, and that amplification is put directly into typically an individual who's wearing hearing aids, and it kind of drowns out background noise as well. Cochlear implants, there can be there's a little bit of a debate, I guess, if you will, in the deaf community, big D deaf community, on the use of cochlear implants. There are a lot of built-in alternative input features that are in our computer right now, so I don't know how, they're all under, like a control panel or the settings. I would say that both Microsoft and Apple products, both of those organizations have accessibility teams. So they're hiring people with disabilities to basically ensure that their products are accessible by individuals with disabilities. And so if you go into the settings, or you go into the control panel and the accessibility settings, you're going to find things like sticky keys and shortcuts and ways to enlarge the screen. You're going to find voice recognition that's already built into the computers, text-to-speech that is there, within our smart technology and with our computers as well. You can change font size, you can change contrast and resolution on your computer. So these are all built in, and if somebody is needing some modifications to a computer, my go-to was always try what's there first and see if it works before you move on to the heavy hitter products, because there are products that will enlarge a screen tenfold, screen magnification products, and there are software applications that will change the color in various different ways, more so than what's already built into our screens. The voice recognition that's built into computers isn't bad. The one that's built into our phones isn't bad either. Nothing is 100% accurate all the time, but and a lot of times it can take some training, but there is also Dragon Naturally Speaking, which is one option, but probably the best option out there on the market for speech recognition if what is built into the computer is not enough. So kind of going back to Dragon Naturally Speaking and having like a monopoly essentially on speech recognition software. If somebody, especially older rehab counselors, say, I hate Dragon, I don't like it, I always encourage people to try out the new version. Nuance, the manufacturer of Dragon, releases updated versions almost on an annual basis, and they really do try to fix the glitches that are there and try to improve accuracy for the product itself. So every year they do improve those products. So on slide 9 here, I've just got some pictures. Pictures of different keyboards. Big keys keyboards are the ones that are the multicolored ones, and they literally are big. They're very large, and they can be useful for somebody that has a vision impairment for one, and maybe needs to have the larger keys. They can be useful for children that are learning how to type and don't want to do just the QWERTY keyboard. They can be useful for individuals that have upper extremity limitations and need a little bit more space. So there's a one-handed keyboard smack in the middle. That's the weird curved-looking keyboard. We've got a Braille input device with the Google on it. The red and yellow switch-looking thing on the bottom left-hand side is a foot mouse, which is a lot bigger than it actually looks. And that little thing to the right of it, you actually put your foot in it. You strap your foot in it. And then we have an on-screen keyboard that's larger, so somebody that can't or has difficulty manipulating things like fine dexterity, like using their fingers to touch type, can be using like a palm or the side of their hand to enter in information on a computer. And then in the middle top, that's a webcam that can be used for head tracking or eye gaze. When we're thinking about health maintenance, this is a whole new world as well. And here I've got a picture on slide 10 of a new type of pacemaker that is like the size of a tiny little pill. So it's crazy to think in terms of health maintenance and medicine and what the medical technology community is doing and the crazy ways that things are changing in that realm. So there can be alternatives that are useful for individuals that maybe have had a product like a pacemaker for some time and just need to have things kind of updated to make their quality of life a little bit better. Telemedicine and telecounseling are two that I like to put in here as more of a service, of course. And I know I'm stretching it a little bit, but they can be very useful, especially for people that live in rural areas who do not have access to a doctor easily. Maybe they can't get there. Maybe transportation is not, public transportation isn't a thing. They don't have it in their community. That certainly is the way it is here in West Virginia for a lot of individuals. So telemedicine and telecounseling can be useful alternatives so that people with disabilities are getting the services that they need. All right, so moving on to slide 11 and looking at AT for cognitive and intellectual functioning. So there are software applications that assist individuals with reading and writing. It's Read and Write Gold is one that's just kind of popping into my mind. So they can, more so than what like Microsoft Word will do, these applications can go in and they can check grammar, they can check spelling, they can highlight things for individuals. There's mathematics software that can help individuals that have different learning disabilities that are around math and organization. There's organization software in general. So if somebody needs more than just like a paper calendar or the calendar that's on our phones, there's software applications for that. Environmental sound machines can be very useful if somebody needs to be able to focus their attention a little bit more or needs to drown out background noise in order to keep their attention and focus. Noise canceling headsets can be useful too. If you're thinking about people working in like a cubicle setting and how much background noise there is in an office in general, noise canceling headsets can be really useful. There are lots of different apps for relaxation, apps for organization, for time management, you name it, there's all different types of apps out there anymore. And a lot of apps that are available are specifically designed for individuals with, like, let's say autism or PTSD even though that's not an intellectual functioning issue. But there's lots of different apps out there. The only kind of warning I put with apps is that they do get updated from time to time. Some of them need to be connected to like a Wi-Fi service if they're going to work appropriately. So it's always just kind of good to look into the app before somebody purchases it. Or if it's a free one, it might not actually offer all the bells and whistles that the paid one would, and so you might just be downloading something on a phone for no purpose. Okay, so slide 12, universal design. There's 7 principles that underlie universal design. Very important to know, just an FYI, keep the slide in the back of your mind. So what do we mean by universal design? Well, that's designing our environment, kind of on the largest scale, designing our environment for use by everybody. So individuals with disabilities, individuals without disabilities, taking into consideration what people in general might benefit from. And so these 7 principles really are thinking about how we can design a building, or how we can design a workspace or a retail establishment or a restaurant, so that we're not putting barriers or we're not putting barriers to access or building barriers to access in our world. So ideally, when we're thinking about designing a product, And this could be, again, like looking at computer systems or phones or anything. Equitable use, that it's available for people. Flexible use, that it can be used in different ways. That it's simple and intuitive, so we're not getting overly complex with our products that are being designed, so that an individual who is, let's say, older and is new to the world of technology is not receiving a product and not knowing how to use it. I mean, I think of the iPhones in general and the iProducts as, kind of having that standard of being intuitive, because they don't even come with like a user manual. So that's an example of universal design principle. Perceptible information. So if the information is out there on how to use these products or devices, that it's easily accessed. Tolerance for error, that there's not a lot of things happening with the product that are frustrating people in general. And in addition to that, the individual should, kind of on the flip side of it, if we're doing an AT assessment, which I guess I'll talk about here in a second, we're making sure that we're suggesting or recommending AT products that are on the same level as the individual in terms of understanding how to use it. We're not giving children high-tech stuff that they don't know how to use. Although I think a lot of children nowadays probably are more well-equipped to use the high-tech stuff versus older adults. I digress. If a product should require not a lot of physical effort. If we're thinking about automatic door openers and doors opening in general, it doesn't require any kind of physical effort, and that's beneficial for individuals that use mobility devices. It's beneficial for moms carrying 18 bags inside of a building. It's useful for an older individual that doesn't have the strength to open a door that's pretty heavy. So that's an example of a product that was universally designed. If you're thinking about like larger bathroom stalls, I mean, that's another, or automatic flush toilets, sinks that turn on automatically. All of those are products that were built on these 7 principles of universal design. Okay. So different resources, I mentioned a lot of these already, the state AT projects, of course, voc rehab agencies, there are assistive technology professionals, so people that have advanced training in assistive technology in general. I have the ATACP certificate, but there's an ATP, which is an assistive technology professional. It's not a certificate. I don't think it's actually a program that somebody might go through. So there's also rehab engineers. So these are individuals that have, 4-year degrees in rehabilitation engineering, and they're the ones that build things that don't exist for people with disabilities. It's a really neat job, and they have their own organization called RESNA, R-E-S-N-A. A lot of AT projects are connected with RESNA, obviously, as well as voc rehab agencies know about RESNA. I would always refer to RESNA if somebody had tried, a product or a couple of products out and nothing was working, or if they worked in like a unique environment and needed to have something customized for them. An example of customization that's been done by RESNA, so I know that one time they had somebody that was working in like a grocery store, I think, as a cashier, and was using a mobility device and needed to be able to access the cash register and be up at a higher level, essentially. Well, they were thinking a higher level, but instead RESNA built a whole register system that was relatively inexpensive, so the cash register could be lowered for this individual and then raised up again for anybody else, because they didn't want to make a permanent modification to the cash register station. They wanted to do something that was basically retrofitted to the person. There was also one that I know of where they were working with somebody that worked at a fast food restaurant and used a mobility device. Not that they only work with people that use wheelchairs, but this individual was not able to access like the drive-through window, and so they built a height adjustable platform so it could raise up. The individual would just wheel right onto the platform. There were safety straps there to secure the wheelchair, and then push a button and the whole platform would lift up for the employee, and then when they were done with their shift, lower it back down. Everybody else could just walk up to the window as needed. So anyway, those are a couple of examples of what RESNA can do. And they're not always expensive. A lot of times customization is relatively inexpensive. So it just depends on what's being done. Centers for Independent Living can be a good point of contact for different ADL type assistive technologies, activities of daily living, and again, the Job Accommodation Network. So if we're thinking about how to select an AT device, now, if you're working in kind of general mental health counseling, you may not go through all of these 10 steps that I have on slide 14 to select an AT device. It just depends. It depends on how involved you're going to be in the process. If you are working in an AT project, sure, you're going to be going through these steps. If you're a voc rehab counselor, you very well may be going through all of these steps too as part of your IPE. So what you're starting out with, at the very first step is identifying the problem. What barriers to access exist for the individual, and then you're evaluating what is actually needed. And then you're looking at the assessment of the barriers that would to implement the assistive technology. So if you're thinking about whatever it is that's needed, I'm trying to think of an example, and I should have thought of this before I started talking, so I could kind of take you through the process here. Let's say we have an individual working in an office setting, needs to access a computer, and is unable to type on a frequent basis, okay? So you're identifying the problem. Can't access the computer. Evaluating the needs to access the computer. So it's pretty simplistic here. Assessment of barriers to implement the technology. Is the computer old? Can it handle additional software? Does it have memory space? Development of alternative solutions. Okay, so that's looking at how can we get this individual access to the computer. Okay, well, we could look at different types of keyboards or mice or speech recognition software. And so step 5, you're selecting the alternative. Okay, we're going to select alternative keyboard and mouse first. Then we're going to be looking at who supplies them. Where can we get these products? EnableMart is one of them, so I'm just going to throw that one out. Then we're thinking about funding. Who's paying for it? Well, I'm a voc rehab counselor. I need to get this person to work, so I'm going to go ahead and say I'll pay for it. It's like $500 maybe for an alternative keyboard and mouse. Then we're going to be actually purchasing the product and putting it into the office space. So we're going to be doing a solution trial. We're going to try it out and see if it works. Step 8. Then we're going to come back and reevaluate. Oh, it seems like it worked. Great. But then we're going to follow up a little bit down the road. We follow up and we find out that the mouse isn't the best, and it runs out of it was a wireless mouse and it runs out of batteries all the time, and so we need to get a stash of batteries in place too. So that's the follow-up part. So if you are in the process of looking at an AT device and thinking about how to select it, there are things here on slide 15, again, that I just want you guys to be aware of. You may need to be using a team approach, of course. You may be bringing in rehab engineers. You may be referring out for some of these services. You may be referring out to a state AT project. You may be referring out so that somebody can get a full-blown AT assessment done. You might be getting connected with occupational therapists, physical therapists, speech language pathologists, especially with communication devices. Speech language pathologists typically get involved in that process of identifying what is going to be the best product for somebody. Products off the shelf can be costly, so you may need to just have in your counselor toolbox an understanding of where somebody could get funds to purchase products, and establishing those relationships with employers can be helpful, because if we're looking at this from an accommodation standpoint, it may be that the employer is required to purchase the product, and if you have a good relationship with that employer, it can just make that process easier and help them to understand the benefit of putting some money out for a product for an employee. Remember, technology is rapidly changing, so it's really important to keep on top of the stuff that's out there, to follow, certain groups, to look on the RESNO website just to see the changes that are out there. Really, rehab counselors and you all, when you're done with these degrees, should maintain knowledge about AT options. You don't want to be looking at your client and saying, well, there's no way for you to perform this function, when in reality there might be different ways that accommodations could be implemented and different types of AT that could be provided. The individual has to be involved throughout this process, and there has to be consumer buy-in. If you are working with somebody that doesn't want to use technology, you could spend $1,500 on products, but if they don't want to use them, or if they are apprehensive about using the technology, then it was pointless to put the money out. So the individual has to be on the same page and has to have a desire to use a lot of these AT products. And in addition to that, some of them are plug and play. A lot of AT actually requires some training, and so you have to be sure that the individual understands that if they're using like speech recognition software, that there's going to be a period of time where they're training the dragon, dragon naturally speaking, to recognize their voice. The same goes with any kind of technology in general. And you need to properly vet the vendors. There, are vendors that have been around for a long time that, offer quality products. And then there are vendors that kind of pop up and go away. If you're looking at like a newer piece of AT, it's important to see if it's actually been tested out, or if they're in like the beta phase of testing the product. You need to make sure that there are return policies in place, so if something doesn't work, how to get it back so that you're again not just wasting money on something. And again, go back to slide 13 for those resources. There are organizations that do the vetting of the vendors for counselors that are out there working. So, all right, with that, I'm going to leave you guys to look at all the other resources that I put on this module and to get started on Module 10 discussion.